everyone. This is Sherry from the CGH Health Foundation. Welcome to our Smart at Heart video series. We will be talking about ways to prevent heart disease. And today with us, we have Edita Danaiata. She's a nurse practitioner with the CGH Cardiology department. Welcome, Edita.
Nice to be with you today. Thank you for having me.
Edita, when I first asked you to be a part of this program about heart disease prevention, you immediately mentioned smoking. So please tell me how smoking affects your health.
From all of the modifiable risk factors for cardiovascular disease, including hypertension, diabetes, hyperlipidemia, physical inactivity, and obesity, I can say that smoking is the worst. It acts in concert with some other risk factors. On the brighter side, smoking is one of the most preventable. Smoking is the leading cause of preventable death and disease in the United States.
How does smoking harm the body specifically?
Use of tobacco in any form, including smokeless tobacco, harms our bodies in many ways. I want to mention that secondhand smoke has the same effect on non-smokers. People who use tobacco have higher rates of heart disease and all kinds of cancer, mouth, throat, esophagus, stomach, liver, colon, even certain blood cancer called leukemia.
Cigarettes must contain some pretty bad stuff then.
Cigarettes contain more than 5,000 chemicals, including arsenic, formaldehyde, and tar.
So nicotine affects your cholesterol levels and the health of your arteries?
The nicotine in tobacco accelerates atherosclerosis, narrowing arteries, and hardening of artery walls. It induces hyperlipidemia, injuring endothelial cells, and even promoting thrombosis. Smokers are 5 times more prone to get peripheral artery disease than non-smokers. While using nicotine, the oxygen in the blood is reduced. So the heart has to work harder to supply with what is needed. To keep up with the demand, the blood pressure increases and the heart rate speeds up.
Edita, what happens when you quit smoking and how soon do you see results?
The good news is that the risk of heart disease begins to drop after quitting. Nicotine is staying in the system for about 6 to 8 hours, but we can see results even sooner. 20 minutes after stopping tobacco use, heart rate and blood pressure returns to normal levels. 2-3 weeks after stopping, circulation improves to all parts of the body. Within 9 months, cough and shortness of breath decrease. And after a year, the risk of heart disease can drop to half of that of a smoker.
Thank you, Edita. So now we know that one of the ways to reduce your risk of heart disease is to quit smoking and to avoid situations where you're breathing secondhand smoke. If you're a smoker and would like to quit, there are multiple tools you can use. You can get help from your provider or from the Illinois Tobacco Quit Line. Their toll-free number is 866-QUIT-YES or 866-784-8937. Their website is www.quityes.org. We will be providing additional tips for preventing heart disease every month, so be sure to watch for our Smart at Heart videos.